national goals and health schemes which are focusing to the children. India is the country giving much importance to the children. Children are the future India. The first one you can see as the Nidhi Ayog. What is Nidhi Ayog? Nidhi Ayog is a national institution for transformation India. 2015 Planning Commission has been replaced by the Nidhi Ayog under the Pradhan Mantri Narendra Modi. Main thing, this one they are telling about reduce the IMR to 30 by 1000 live birth. It was 40 by 1000 live birth. Reduce the under 5 mortality to 38 by 1000 live birth. It was 48 by 1000 live births. Next was MDG goals. It's called Millennium Development Goal, also developed in 2015. We have 7 goals. In the main 4 goals are focusing upon the children. The goal number 1, eradicate extreme poverty and hunger to prevent the nutritional disorders and prevent the malnutrition. Goal number 2, achieve the universal primary education. Goal number 5, promote the gender equity and empower the woman. Goal number 4, reduce the child mortality. All these schemes or all these national schemes are channelized through the primary healthcare center and the sub-health centers, through the Anganwadi workers and Palwadi workers too. Sustainable developmental goals. This also 2015. It is also planned for goal number 1, poverty. End the poverty all form everywhere in the world, in India. Goal number 2, zero hunger. Achieve the food security, improve the nutrition, promote the sustainable agriculture. Goal number 3, good health and well-being, to ensure the healthy lives, to promote well-being of all age group of the children, to prevent the child mortality. Goal number 4, also quality education, giving primary education and give compulsory education to 6 to 14 years. Goal number 5, gender equity. If you prevent the female infanticide, it will focus on the gender equity. Goal number 13A, prevent the violence against the children. Next, if you see National Health Policy. National Health Policy 2017. Also focusing on most of the goals focusing about the children. Reduce the under 5 mortality to 20,000 live birth by the 2025. Reduce the IMR rate, infant mortality rate, to the 28 by 1000 live birth by 2019. Reduce the neonatal mortality rate 16 by 1000 live birth. Stillbirth ratio should be in a single digit. 90% of the above infants should be getting immunization by 2015, at least 1 year vaccine preventable diseases. Increase utilization of the public health facilities by 50% by 2025. If the immunization, maternal care services, other services. National Population Policy, also focusing many goals in the National Population Policy focusing on the children. It addresses to the unmet needs of the reproductive and child health services. And it also make the free school education, compulsory school education up to 14 years, 6 to 14 years. Reduce the IMR to below 30 by 1000 live birth. Achieve the universal immunization to the children against all vaccine preventable diseases. Promote the delay marriage for the girls after 20 years of age. Achieve 80% of institutional delivery so that you can prevent the IMR. 100% of the delivery by the trained personals. Achieve 100% registration of the birth and death. These all national programs all going through the channel through the primary healthcare center and the sub-health centers. According to the program, each government, either the central government, state government, are making so many schemes. Here mostly central government scheme along with state government implementing those schemes. First one, JSSK, Janani Shikshu Suraksha Garanya. It is estimated where it provided the mother and the neonate within 48 hours. Whatever the care, they are giving the free transport and immediate services. It's also implemented the mother who is living in a rural and urban area to prevent the infant mortality rate and also MMR. Beti Bachao Beti Badao scheme. It is also the saves the daughter. It prevents the female infanticide so that the male gender equality will be there. Then NAPC, that's a National Action Plan for the Children. It's like a public-private partnership approach with the private, mainly to improve the access of the health and education to the children and protection and participation of the children in their decision making. What they are going to do, what is their interest in education. IMNCI, Integrated Management of Childhood Illness. Most of the children are dying with the respiratory illness and other things. So we are giving the health training to the health workers under the strategy of RCH2 and NRHM. These health workers will be identified, putting the tag green, yellow and red tags, and immediately refer the children to the primary health care and nearby hospital. ICDS, Integrated Child Developmental Scheme, which is implemented in all districts. So they give primary education and nutrition to the children. Beneficiaries are the pregnant women, including lactating mother and children till age of 0 to 6 years. Midday meal schemes. It has been implemented in all the schools to prevent the schools dropout and to improve their nutritional status and prevent anemia. Sarva Shiksha Abhiyan Yojana. Sarva Shiksha Abhiyan Yojana is mainly promoting 6 to 14 years of the compulsory school education. Then Suganya Samriddhi scheme. It is an attractive interest given to the post office if you take a saving scheme on the name of the children. Operation Blackboard. It improves the primary education to the children. KARA. It's a Central Adaptation Resource Authority under the government, central government of Ministry of Health. For the orphan children and destitute children has been, they develop the protocols how to adopt the children or immigrate the children to national, international adaptation policies they are making and adopting and protecting and prevent the children from violence. National Nutritional Mission, prevent the nutritional disorder for all children. Pradhan Mantri Matru Vandana Yojana. This is 5,000 rupees incentives given in a 3 installment to promote the health of the lactating and pregnant women to prevent the IMR and MMR. National Scratch Scheme. It's only focusing on the working women they are going for working women, mainly to give crèche facilities for 6 months to 6 years. Scheme for adolescents girls to improve their life skill education to prevent also their anemia. Child Protection Scheme under the UNICEF, response to the violence immediately and abuse and neglected children taken care. Boshan Abhiyan Scheme. This is also 0 to 6 years. Adolescents, girl, pregnant women and lactating women or beneficiaries under the umbrella of ICDS. Everything has been taken care by the Anganwadi and Balwadi workers. Mission Indradhanush. It's also taken by through the primary healthcare centers and sub centers by the ANM and other health workers. They go to door and vaccine preventable disease vaccination given to all the children and up to the age of 2 years to prevent the communicable diseases and death of the infant neonate children. So if the question especially coming for the MSc students, national goals which is focusing or national health schemes which is focusing on the children. So most of the scheme, either you take a health policy or national health policy or 5-year plans. Last 5-year plans was a 12th 5-year plan. Now it's all Nidhi Aayog, it has come. And then sustainable development goal or millennium development goal, 80% to 60 to 70 to 80% of the goals are focusing on MCH services, maternal and child health services. Thank you.